May I request Dr. Manisha Shrivastava from AIMS to kindly respond about how has AIMS, the premier medical institute, leveraged digital technology to increase operational efficiency as well as the patient care experience. Yeah.
So, if you speak in terms of general hospital care, what Dr. Nitin was saying, that we have, non-COVID and COVID facility. So, thanks to the infrastructural development that we had already got, kind of online services going on for patients who take appointments from doctors, and we have a telemedicine center in place. Although due to certain legal norms, we cannot generally prescribe the drugs and everything, but we can all have follow-up of patients. So AIMS is connected all over India with the telemedicine services, and we have also got a hotline service for all our patients who are asking questions about COVID-19 service, as well as, so every day we have a data coming up to us. And these testing times of pandemic, taught all of us Indians who are so fond of actually not becoming, savvy to the digital technologies. We say we are old timers. We are not so old timers like me. So, we're not using smartphones the way they should be used. We are just WhatsApping, or, we are just using them for phone calls. But actually, this technology came in place first because we had the lab information system in place. So the first thing what Mr. Ajay was saying, making as many things paperless as possible. So we have all the reports, all informations, everything transmitted to the ward and other through this lab information system now. And a little disintegrity was there, which has become integrated in these difficult COVID times. So that is one. All reports which we want for patients are being sent through this digital technology. And currently we don't have this online system appointment because we have restricted our OPD services, but emergency is going on. So all patients who come to emergency, their images and their reports and everything is transmitted to doctors. As sir said, Nitin sir, this is the time we have to live with this for a long time, perhaps. So social distancing, and we have infrared thermal scanners that have come in. And in fact, I would like in future, I think we will have to be very cautious and have all these digital technologies for screening patients at the doors with available thermometers, because we cannot have so much of manpower only trying to screen people. So this is one addition, very simple addition, but infrared thermal scanners are everywhere now. We have to scan as per the Government of India guidelines in non-COVID facilities, also our staff as well as all patients. And again, for this every ward and every facility, we have different WhatsApp groups. That is the best facility we have done, that we click pictures of our patients' prescriptions who come and who get admitted, and they are transmitted again. Everybody is still, all night this goes on. So we are reading about all patients' informations in the WhatsApp groups, and we are understanding what is going on. All reports and everything is there. So doctors are consulting amongst themselves, and telling the doctors and nurses inside the wards also what to do and what not to do. So this has actually completely changed our way of working. Most of the things are coming online only, and we have every day we have a task force. So whenever we have to meet, we have Zoom meetings, and we immediately take the corrective actions or whatever is required. In terms of infrastructural, you have seen that lot of facilities have had robotic functionings also, like for serving, for attending to patients. So this is something which we are looking forward to add in our system, which we have not got right now. So because there is a lot of issues about infectious disease. What I was thinking was that very simple thing was that the all LIS and all HIS, which was not there in very many hospitals, should be added. And I think computerization is the first step which every hospital should take in place. what is happening is the whole infrastructure is ready, and then we are trying to get into the digital technologies, and which becomes very difficult. And for chronic diseases, we can stratify various diseases. One is that acute emergency if they need, that's a different thing. For chronic diseases, always teleconsultation is something can be monitored. We had developed a poison information center in the institute this pandemic started, and which is a unique example where anybody from all over the state or all over the districts can consult our forensic department people to actually know what type of poison it could be just through the poison information system. Similarly, the what sir said was all the trainings for this pandemic from AIMS Delhi have happened online, and we have been participating in those training. Nobody was aware about how to wear PPE, what to do, all this, and it's just it's not a kind of a fancy item. It's a very very difficult, kind of a garment to wear these difficult times for all healthcare workers. So donning and doffing trainings, the areas where the areas where the staff needed training was the digital technology best utilized all over the country. And because physical distancing is also in these infectious diseases is a dictum, and everybody and anybody will have to be on their own, but that is only through digital technology we are in touch with each other on a non-touch technique. So maintain distancing, but keep in touch only by digital technologies, and it's been really working well. So we are sending all our reports, all the database for patients is being maintained. Like we are getting samples from all over the districts, and those samples are the data entry operators are first making a big database of all the patients who are coming, their addresses, because of these things the patients addresses have to be traced, the contacts have to be traced. If we have to contain this pandemic, I think digital transformation of the hospitals is the dictum. Thank you.
Great, Dr. Manisha. We all can see that the amount of hard work the doctors and the hospital administration is putting in these crisis times is amazing. And we all, as a nation, are grateful to all our doctors who are on the forefront and fighting this battle. Thank you and hats off to you
Thank you.
and your team. Yeah.